Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. How is the United States comparing to Canada during the COVID-19 pandemic? Find out more right now. My guest this evening is Dr. Yazdan Mirzanejad, an infectious disease specialist and clinical associate professor, Division of Infectious Disease, the University of British Columbia, Vancouver, British Columbia, Canada. Yazdan, welcome to Housecall.
Thank you very much, David, and thank you for inviting me.
My pleasure, my friend. Great to see you again. So certainly, all countries globally have been challenged by the public health pandemic, this COVID-19. But what has evolved over the past few months is that some countries have been better at managing this than others. And that's why I thought it would be fascinating for our viewers to hear your take, your perspective from across the border. So briefly, tell our viewers before we proceed with the topic at hand about your professional background.
Thank you, David, again for inviting me to your program. I am a graduate of one of the medical school in Middle East in Iran, and I immigrated to Canada in late 80s and been a Canadian citizen ever since. And I did my postgraduate study in University of British Columbia and Manitoba. And then I had the opportunity to further extend my training in medical microbiology and infectious disease. And I moved to United States at Vanderbilt and trained by world-leading infectious diseases there. And then I moved to South America for tropical medicine, and then back to Canada. And here I am. And one of my journeys and trip meeting lots of wonderful people like yourself.
Oh, you're kind, my friend. So let's go back to the early moments of the pandemic as you experienced it in Canada. Let's go back to February, March. What kind of news were you receiving that point from your provincial health department, as well as from Ottawa itself, the capital, about what was going on in Canada?
Yes. Well, it was initially the first time we heard about this virus, which we initially called it Wuhan virus. And that was towards December. And at that point, we were just waiting for further information while we stayed very alert. And then in January, things weren't not much of a change of COVID-associated panic that happened to the whole world. But we were getting the numbers that are increasing in China, and did not take a long time for them to turn things around in matter of 2 months by building the new hospital and doing the public health measures. And that was around early March when we basically got the message, and our government locally and federally, they try to basically prompt the whole stakeholder to be rising against this virus by getting the public health structure, which was very well developed, especially in our province in British Columbia, along with sending the trusting messages to all the physician healthcare workers and to the public, which their compliance with recommendation was extremely important to make this very successful. Therefore, around March and early April was that we had the first hit in our nursing home, and from there on, all the activities started, parallel to what was happening in your state of Washington, Seattle. Yes.
Now, what were the original sources of infection in your country?
Well, I think they initially was part of the return travelers. And then after that, we try to do two things. Number one, to limit the return travelers, which a lot of effort been made by public health, by community medicine, by federal government, by airlines industry, and tourism. Everything went together to stop coming back of the non-Canadian return travelers, and for Canadian also asked them to come in as soon as possible, and we put into the place the self-isolation concept, and at the same time using the social distancing, which developed a little bit later, and we came up with the 2 meters based on the data from WHO and CDC, and then be compliant with public health rules and regulation, which was extremely important. That wasn't a time to do anything else other than real scientific medicine. We got all the expert people involved, and basically social distancing, wearing masks, and not fighting over it. And all of this resulted in excellent result for us, which especially in this province. And here we are seeing a little bit increase in numbers, which seems to be something we expected. Mathematically, we numbered these things is going to go up, and this is going to be a challenge for the next few months to year. But here we are.
You mentioned some of the important public health measures embraced in Canada. Social distancing, you say 2 meters, we would say 6 feet, and then wearing a mask. As you know, in this country, unfortunately, those measures have been greatly politicized. President Trump has been reluctant to encourage wearing masks. Indeed, he even holds political rallies where many people in the audience are not wearing masks. And social distancing similarly has been discouraged. He famously held a political rally in Tulsa, Oklahoma, 6 weeks ago, where social distancing markers were removed from the arena. So the question I have for you is, did you run into this as a physician in Canada, where the government was giving mixed messages to the medical community and to the public?
Well, I have to tell you the truth, Dave. There was not such a thing in Canada. We had a very tandem work between provincial government and federal government. We had very well developed infrastructure in public health. We had a very compliant populations, which basically did not mix that up with their right of democracy. And they thought that when the expert recommending, this is a trusting relationship, we measured actually their compliance was up to 90%. Of course, there would be some that they would not agree, but they were not dominating the impact. And I think all those measures, one by one, impacted our numbers. There was not one factor. There were many factors that they go hand to hand in a pandemic situation, which was from those that you alluded to. And plus, when we felt that return travelers is no longer a problem, the problem is going to be our local transmission. And in order to control that, we definitely need the social distancing, not social isolation, distancing. We need wearing masks. We need to reduce our gathering indoor and outdoor. And we need to do very actively contact tracing. In many studies done, shown in many countries, like South Korea, like Taiwan, like Hong Kong, if you put the manpower in and you be able to do 75% of the contact tracing that you need to do, you can reduce the numbers by 200 variables. So 200 times you will have less local transmission if your contact tracing in place by 75% of what you need to do.
You mentioned contact tracing, an important topic. Define for our viewers what you mean by contact tracing.
Yeah, the contact tracing is that it starts from the lab. The lab confirms presence of this virus in that individual person. That person can be symptomatic or could be asymptomatic. If it's asymptomatic, the isolation needs to be applied. And if it's symptomatic, again, on top of isolation at home, they need to be watched, contacted, just in case if condition change, come for medical help. And by doing this, and plus, then you will follow and chase down any other contact that's been done by those individuals that they've been positive for this virus. And doing this contact tracing is labor intensive, it's time consuming, but you need an upfront investment for this to prevent disasters that can happen with this virus. So we were so far very successful. We do believe the reason for recent inclination numbers are because we loosen up a little touch to make things back to normal while we stay very watchful. And we do know the case is going to go up, but the cases of admission to hospital gone down significantly. We are seeing increased cases in our younger populations. So while they are watchful, they're going to have contact tracing by public health. They hired 500 new employees by our public health in this province to do the contact tracing. So all of those are active working. These are not happening on their own or by chance. So there've been significant of work being done by very expert and pro people in our province, which I'm sure you have many of those in your country. But we also listen to them.
So contact tracing is to call patients who are positive and then find out family, friends, contacts they've been in touch with to try and contain this, to limit the exposure. So an important follow-up question to that is, how important is the contact tracing to do? Is it, can you do it, is it important 1 day later, 5 days later? Is there any value doing it 10 days later? Or does the value go out the window the longer you wait?
Actually, excellent question, David. That needs to be done as soon as possible because there are data out. If you delay your contact tracing, your number will go up on the opposite direction, something that you do not want to see. So contact tracing is a very time-sensitive issue, and you have to do it as soon as you get the result from the lab, get hold of the person, instruct them for the self-isolation, be in touch with them, see how they develop in the next 10 to 14 days, and then everything is fine. Again, with public health rules, they go back to the normal circumstances. And contribution of everyone is important in controlling this pandemic.
So in Canada, how available from the beginning has been testing for COVID-19?
Well, the COVID-19 testing initially was like everywhere else. We were trying to get those kits back and running, and our numbers were not out of control. But despite all, we learned from countries that they turned these things around were the countries that they did not put limit on availability of the testing. So we thought, to fight our enemy, we need to know where they are. And in order to know that, the testing is the best tool to tell us. And that's what we followed. And that's why up to this moment, things are even getting easier. We have 300,000 people that they've been positive tested. And amongst those, we have so far in our province around 200 deaths in the last 6 months, with the number of, on average, 1 per day. And unfortunately to say that, as opposed to your country, that 1,000 per day. So that's it. Basically, the comparison of the measures that put in in a very tandem, wise, expert opinion oriented, with support of public and support and compliance of people and support of federal government to allow people to stay home, not to go work, to be worried about their rent, their food. So all of this been a great efforts together, and I cannot ask for any better fortune than this we are seeing in these months, and that should be used as a role model for the rest of the world.
Sure. So if I, as a citizen in British Columbia, want to get a test, how long would it take for me to get it scheduled?
You can get it done in less than 22 hours.
22, so less than a day.
That's correct.
Okay, and then if I get the test done, how long does it take to get back?
They get back to you?
Yeah, the results back to you as a referring physician.
Right away.
Within hours?
Yes, absolutely, and even on the hospital side, we do have the units that we keep them there until we have the results ready before we take a chance and mix them with the rest of the population in the hospital. And the masks and personal protective equipment, everything is everywhere, and there'll be no shortage of this, no fight over it, and being properly used. And also we advise not to use it when it's not necessary.
Sure. So I'm sure you've seen the stories out of the USA that patients who want to get tested are told they may have to wait a few weeks to get tested. Or you've seen the video clips all over the USA of people finding out their testing sites and waiting in their cars online 6 or even 8 hours at a time. How do you react to that?
I think this is an example when your demand and supply, they do not match. And this is basically, we do know it's pandemic. We do know that there are some panic behavior there, but those all are expected, a part of the normal human behavior. Those are not the reason that people be negatively feedback that if you come here, you're going to wait for 10 hours. Maybe that's how we indirectly reduce the number of tests, because people don't want to wait that long. We think that people should have access, those who are justified to do the test right away, and should not be any waiting, because also waiting is a risk of transmission in line. And basically they are waiting, they have contact time, and definitely this is not risk-free. So it takes a lot of effort. But also, David, remember, you have one of the greatest countries in the world, large population. And I can understand why at the beginning there was not a catching up with the need. But now, been 6 months past, and I don't see a lot of reasoning to explain this. We have to move forward. We have to save our population to whatever it takes to support them. And they need to trust their public health, their leadership, and smart people, intelligent people, entitled to their democracy. But at the same time, they need to be protected and be available to them what they need to deal with this pandemic.
Given what you said about the importance of timely contact tracing, how do you react to a frequent report that when you get tested in the USA, it may take up to a week to get the results? Is there any value to that test?
This is that definitely is not the definition of the contact tracing in an epidemic situation. Time is an essence, and any delay by 2 to 3 days exponentially increase the number of the new cases in the opposite direction that you do not want to see. So this is not acceptable. By public health, if you talk to Bill Schaffner, who taught me about epidemiology at Vanderbilt, he will tell you the contact tracing starts from the first minute after you diagnose the case. So we cannot justify that. This is not politics. This is science and medicine and safety of people who trusting us at the time like this to be helped. And
Hold
those
that thought. We're going to pause for a public service announcement. More with my special guest, Yazdan Mirzanejad, an infectious disease specialist from Canada. We're talking about COVID-19. We'll be right back.
What can we do to make an impact in our community? We can share our knowledge, be leaders, or simply participate in the 2020 census. The census wants our community to be counted accurately. That count informs decisions that affect funding for hundreds of programs, like Medicare, daycare, and arts education. When the community comes together, anything is possible.
Shape your future. Start here. Learn more at 2020census.gov.
We're back. My guest this evening is Dr. Yazdan Mirzanejad, an infectious disease specialist and clinical associate professor of medicine, Division of Infectious Disease, the University of British Columbia, Vancouver, Canada. Yazdan, welcome back.
Thank you, David.
So
Nice.
let's go on to discuss the Canadian public reaction to the recommendations made in terms of public health, wearing a mask, social distancing, staying at home for a while, avoiding public gatherings, all these things. What was the reaction in British Columbia as well as throughout Canada?
I can mainly talk more for British Columbia because I stayed throughout the pandemic time, and also I'm aware of what happened in other cities. Some cities like Toronto and Montreal, they got off guarded at the beginning, and there were some small issues which they were fixed very quickly. But the announcement came towards the last week of March, when government started to come up with this plan, a plan that allow people to be compliant with recommendation, not being worried about losing the job, not to be worried about their rents, not to be worried about their payment if they don't go to work. So that was a very important, and all this compliment to the government, federal government of Canada. And then at the same time, we had a daily touch between the provincial government and public to keep them abreast with what's going on in the world, what they need to do to keep our number down. And they were very clear that from here on, from April on, the number that we got that were imported, but the next phase is we basically flatten the curve. And in order to flatten the curve, we have to control local transmission. So that basically was very clear at the beginning to the public. And public, based on the statistics that we did in this province from 380,000 people, we had up to 91% compliance with filling out the form and also saying yes to this measure, because we eliminated things that could bother people with their financial needs for the place they live. So that became a very coordinated effort from federal government to local government to infrastructure of public health to expert advice and to reception and understanding of public. So that's what I personally believe. All these efforts together resulted in such a good result in our province and some other provinces in Canada. And totally right now, despite numbers going up, that was anticipated, but we are following them very closely and publics are very compliant.
I, of course, reside in Montgomery County, Maryland, and they've had a very excellent coordinated job of public education and a high degree of public compliance to follow the guidelines. Unfortunately, in the USA, that has not always been the case. There have been certain states where the governors wanted to open up quickly, and now they subsequently have paid the price with a peak. Most recently, in our state of North Dakota, there was a bikers convention with 250,000 people with motorcycles going to a town in North Dakota. How do you react to that?
Well, I think that's just not what you would do in a pandemic situation. You want to do exactly the opposite, because the recommendation is stop gathering. Because we do understand this is coming based on the science, based on this virus, how fast and super fast it can spread, how fit that is into your nasopharyngeal receptors, how can easily attach and stay there. And now that we are understanding, even after you get the first time infection, you can again be reinfected in subsequent weeks. Now, due to mutation or your immunity is not perfect, those are still not be determined finally, but the final impact is on our new cases. What we need to do, bring down the new cases, incidents. And how can we do that? One of the most important is social distancing and stop gathering in indoor, outdoor. So that definitely was against the public health advice anywhere in the world, David.
Well said. Let's transition to treatment options and prevention. Of course, everyone globally is awaiting for approved vaccines that are safe and effective. And I know that there has been some reports out of Russia and China that they already have vaccines. But there's a great deal of skepticism in the global medical community whether that is true or not. What is your sense about a vaccine being approved in Canada in terms of when it will be available?
I think Canada always goes with the very logical flow of the science because feels responsibility for the public. And based on our evidence in science and medicine, you cannot approve a vaccine, a new modality of treatment, unless you have done the stage or phase 3 clinical trials. Meaning that what you got the good result on phase 1 and 2, now you're extending to bigger number to make sure those were not happening by accident, but is by knowledge. Plus, to make sure that there is not any uncontrollable or unknown side effects. And plus, we seem to be dealing with a virus that is mutating. And we're already having a few mutations circulating of the same virus. Does not seem to be the same virus that it was 6 months ago. So that is going to bring lots of questions about the efficacy. And I'm not saying that the vaccine, definitely vaccine is going to be a great protection for the public in the world and for ending this pandemic. But we have to be careful about which one to use, where it's going to affect, and what and how long is going to last in terms of immunity and not having ill side effects.
As you know, the flu vaccine has to change every year because the flu virus, so to speak, mutates. It's a molecular biologic chess game. Do you think that's going to probably happen with the vaccine for COVID-19, where we'll need to get an update every year?
Probably we are too early to make comment on that, David, at this point, but any options is on the table. We have to think about it very carefully. The first priority right now for us is to survive this pandemic, bring it down to a level that herd immunity can protect the world, and then we're going to be worried about what's going to happen after. And at that point, we have 3-4 different scenarios that have been projected and predicted. One is that it's going to be a slow burn virus on and off for a number of years. It's going to be this season of the flu season could be a big hump back again. We have to be prepared for and asking all eligible people to be immunized. And the rest of your excellent questions, I do not believe I am ready to make any comments on, just because those datas are lacking.
So we have 2 minutes left, and I'm going to go through a couple of quick questions. Number one, there's been a flurry of interest recently in convalescent sera. Define for our viewers what convalescent sera is and its potential benefit in COVID-19.
Yeah, convalescent serum is a modality that's been used over the last 100 years. And we used them even before we had antibiotics. Definitely, they showed efficacy in Ebola virus pandemic that we had. And now there are some data out that it can be helpful. And assuming that it's 100% effective, which I'm not sure we have that data, but also is the accessibility to this. How fast we can get that and how we can pool them by blood bank and get them ready when we are still worried about people not to get the infection in the first place. Those who are needing treatment, how fast we can get to them. It means that we have to detect people who have immunity first and then allow to pool of those products to be used on people who were needing these products for cure. And definitely, I think it's promising. And how practical it is, I think there are some issues. I know FDA came about it and talking about it, and we do know about all those, but I'm not sure is very easily applicable. But definitely can be great revolutionary medicine for something that we do not have treatment and we do not have the vaccine.
Yazdan, thank you for joining us on Housecall.
Thank you very much, David, for inviting me, and it was nice to be with you.
My pleasure, my friend. My thanks to my guest, Dr. Yazdan Mirzanejad, for an excellent interview. My thanks to my team at the studio for making this show possible. And my thanks to you, the viewer, for joining us this evening. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, I'll be interviewing the president of the Montgomery County Medical Society, and the topic will be the challenges of private practice in the COVID-19 pandemic era. It's going to be a fascinating show. See you then next time for another edition of Housecall. Good evening.